Hi, I am Dr. Ahmed Manjeed Hamza Al-Shammari, the head of Experimental Therapy Department at Iraqi Center for Cancer and Medical Genetic Research. Today, presenting my work with my student Huda Ramiz and my colleague Maha Altai. The current work entitled Newcastle Disease Virus, Rituximab and Doxorubicin Combination as Anti-Hematological Malignancies Therapy. Hematological malignancies are a collection of heterogeneous conditions that originating from bone marrow cells and the lymphatic system. There are three groups: leukemia, lymphoma, and plasma cell neoplasms. Even with current targeting therapies as rituximab and other chemotherapeutic agents, there is need for developing new treatment strategies. Combination therapy seems the best option to target the tumor cells by different mechanisms. Viral therapy is a very promising treatment modality as it is selective and safe and cause cancer destruction. Newcastle disease virus, Iraqi strain, proved to be effective both in vitro and in vivo. The aim of this work is to investigate the novel anti-hematological malignancy therapy by using a Newcastle virus in combination with rituximab on CD20 positive tumor cells and with doxorubicin on CD20 negative tumor cells, whereas plasmacytoma cell line was CD20 positive as shown in this picture, which is tested by immunohistochemistry, and using lymphoma cell line, which is CD20 negative tumor cells. Isopolychroma analysis of combination for Newcastle disease virus and doxorubicin using different viral and drug concentrations which were applied alone or on combination for a 3 days exposure period. Figure A showing effect on the plasmacytoma cell line and figure B effect on non-Hodgkin lymphoma SR cell line, showing that there was additive and synergistic activity at low and moderate doses on both cell lines. Figure C showing a Newcastle virus with doxorubicin was antagonistic when tested on normal embryo fibroblasts at most doses used. Isopolygram analysis and figure A showing synergism between a Newcastle virus and rituximab at low doses and antagonism effect on higher doses on CD20 positive plasmacytoma cell line. Figure B showing antagonism at most doses used on normal embryo fibroblast. The P53 quantification assay was used to determine the possible mechanism of action for synergism between the Newcastle virus and current therapeutic agents. In conclusion, the Newcastle disease virus is a very promising anti-hematological agent when combined with other anti-tumor agents. It found to be synergistic with doxorubicin on low dose on the plasmacytoma cells with no involvement of P53 pathways, but involved P53-1 combination used on non-Hodgkin lymphoma cells. In Newcastle disease virus, when combined with rituximab, showed enhanced cytotoxicity, which is a P53 independent. These results indicate needs for further in vivo experiments.